According to the World Health Organization, Uganda has the world's highest malaria incidence rate of 478 cases per 1,000 people every year. Malaria is also the leading cause of sickness and death in Uganda and is responsible for up to 40% of all outpatient visits, 25% of hospital admissions, and 14% of all hospital deaths. The malaria death in Uganda is estimated to be between 70,000 and 100,000 deaths per year, a toll that exceeds that of HIV/AIDS. Scientists in Uganda in 2023 indicated to World Health Organization that they were in the process of developing a malaria vaccine in Uganda. This initiative has been welcomed by GAVI, the Vaccine Alliance, and are ready to support the manufacture of the malaria vaccines in Uganda starting April next year.
Certainly, I'd like also to reiterate the commitment that we have already taken to support Uganda in the successful introduction of the malaria vaccine into your routine immunization in April next year. So we expect to start it April 2025.
This was during a meeting between Prime Minister Robinah Nabbanja and the chairman of the Board of GAVI, the Vaccine Alliance, Manuel Barroso, in Italy.
That the Parliament allocates the necessary budget to cover all of Uganda's co-financing requirements, which will be around $8 million in 2025.
We request that GAVI supports local vaccine manufacturing through the Africa Vaccine Manufacturing Accelerator. Uganda already has a thriving vaccine manufacturing initiative and is setting up pharmaceutical industry parks in Nakasongola, Avema, and is approximately $900 million.
However, Uganda is required to co-finance this initiative by $8 million.
To ensure that the Parliament allocates the necessary budget to cover all of Uganda's co-financing requirements, which will be around $8 million in 2025.
It's our people, and we have a responsibility to look after our people by virtue of being government. We have no alternative but to co-fund. And the government of Uganda has been co-funding, what I know. I will prevail over the Minister of Finance in partnership with my president so that this money is prioritized in our budgets.
Uganda was also commended by Gavi Barroso for the successful HPV vaccine immunization against cervical cancer among women.
And the government, namely the Ministry of Health, for the impressive boosting coverage of HPV vaccine in 2023. When our cooperation started between GAVI and Uganda, GAVI has already disbursed over $1 billion in vaccine and cash grant support. And so this is
for GAVI to sustain the supply of vaccines worldwide, they require about $12 billion.